Hello everyone, this is Dr.Akshata Shanbhag. Today we are going to learn comparative study of Ledum. First we will see what is the sphere of action of this drug. So Ledum is used in injury to nerves from punctured wounds, and it also has action on rheumatism, especially ascending rheumatism, and it has action on the capillary system in parts where the cellular tissue is wanting, like fingers and toes. So it may cause internal bleeding and lead to bruises or ecchymosis like you see in arnica. It also has antiparasitic action because it antidotes the stings of insects. Now we will see the comparison between the drugs. So the first comparison we will try to understand between hypericum and Ledum. As both the drugs are used for nerve injuries, what are the further differences we will understand. So hypericum, we see that the pain shoots from the wound up the nerve of the arm, while in Ledum, the pain is dull aching in the part that was injured. So that means the pain will be there restricted to the injured part, but in hypericum you can see the drawing type of pain which follows the nerve. Then in hypericum it is used when jerking comes on in tetanus, while Ledum is used to prevent tetanus. And in hypericum wound is very sensitive to touch, while here you will find it is not that much sensitive to touch. Next difference we will see between Ledum and Silesia. So in rheumatism we can compare here. So Ledum has rheumatism of feet, ankles and soles which is aggravated at night, which you find even in Silesia. So here in Ledum we see the patient is unnaturally cold to touch but not internally. Subjectively he doesn't feel that coldness, but he is only cold to touch externally. While in Silesia he lacks vital or animal heat and feels internally also cold. And in Ledum there is aggravation from warmth of bed. Silesia you don't find that aggravation from warmth of bed. Ledum has amelioration by uncovering and from cold or putting feet in cold water. So Silesia has amelioration by covering and it is aggravated from cold. So next difference in rheumatism we find Ledum and Calmia. So Ledum, as we know, there is ascending rheumatism. Ascending in the sense the pain starts in the feet and runs up. So there will be hot, swollen and pallor present. There will be a pale inflammatory signs seen in the Ledum. While in Calmia there is descending rheumatism and it is hot, swollen and red, what you find in the inflammations. So Ledum has aggravation by warmth of bed and bed covering, and naturally, as we studied previously, it is ameliorated by cold application or putting feet in the cold water. So in Calmia it is suited especially when heart is involved as a sequelae, or it is attended or succeeded by numbness of the affected part. Then the Calmia is used. So we have studied this many a times in the previous videos also. So hypericum and Ledum is used for nerve injury, arnica, hemomelis and ruta especially for bruises, calendula for lacerated muscular tissue, and Staphylos aureus for clean cuts with sharp instruments. So next difference we will see in the ecchymosis between Ledum, arnica, sulfuric acid and nux vomica. So in Ledum, the ecchymosis occurs with black and blue spots from blow or bruises. While in arnica it removes the ecchymosis and discoloration more rapidly and perfectly. Sulfuric acid, ecchymosis from blow, especially if occurring in cachectic or weakened constitutions with tendency to purpura or breaking down of blood. So nux vomica, there will be ecchymosis into conjunctiva or sclera. So next difference between Ledum pal and Bryannia. The difference is gout is found in both the drugs in grade 2. But here in Ledum pal, the rheumatism occurs with scanty effusion and tends to harden into nodosities. Effusion in the sense collection of fluid. Synovial fluid we call here, when it is related to joints, it is synovial fluid. So it is effusion. But in Bryannia we find rheumatism with copious effusion. That means more effusion will be there. And it is aggravated from slightest motion or movement. And there will be dry tongue present in the Bryannia. So this is all about the comparisons you find in Ledum pal. I have referred E.A. Farrington Clinical Materia Medica, Clark Dictionary of Practical Materia Medica, J.T. Kent Lectures on Homeopathic Materia Medica, and H.C. Allen Keynotes with Leading Remedies of Homeopathic Materia Medica. Thank you.